One of the things that jumped out at me in your book is you cited icandecide.org. It's a group that has banded together with some attorneys to try to get information from the federal government on the vaccines. And in March of 22, they submitted 2 FOIA requests to the CDC for documentation. How many confirmed COVID-19 deaths have there been in children 11 or younger and in children between the 12 to 15-year-old age groups? How many confirmed deaths have there been to the CDC? And on March 10th, 2022, you point out, the CDC responded, we have not conducted the analysis requested for this age group, and therefore we cannot provide you with a data product in response. But publicly, the CDC is claiming that COVID ranks as one of the top 10 causes of death for children age 5 to 11 years. This is why some parents are so paranoid, because they have the misfortune of believing Rochelle Walensky, that it's a top 10 cause of death for the young ones. But as you point out in the book, when asked to submit the proof, they say, we don't have that data set. We haven't done that research.
Yeah. And, I think people have this feeling that everybody got vaccinated and COVID now is not as dangerous as it used to be. So the vaccine must have done it, and the vaccine must be saving lives. But I have not seen any data that shows that. And, those kind of data are easy to get. But what we're seeing from, for example, from the insurance industry, from the CDC, as you point out, is either deliberately or because of incompetence, they're not producing the kind of data that would allow us to do rational decision-making as individuals or as a nation. And that's been one of the most disturbing features of the government management of this pandemic is the obfuscation about good information. But there's a number of people now who have gone out to, and Ed Dowd is one of them, who's, the BlackRock executive, former BlackRock executive, who's gone out to the insurance industry. And the insurance industry is panicked about this because they're seeing a 40% rise in unexplained deaths, in excess deaths. And they're occurring in young people in 2022. So over 2021. So the number of people who are dying since mass vaccination is much higher than the people who are dying from COVID. And
okay, but wait, because what doctors will say
there's a number of other ways.
We don't know if it's the vaccine or deaths of despair or drug overdoses, and it doesn't necessarily have to be from COVID if it's not the vaccine, but it could be from a whole host of other things that have been caused during the pandemic. A whole host
of other things, and we ought to have that data. We ought to know that. Yeah. Why is CDC discouraging coroners and morticians and public health authorities from doing autopsies on people whose deaths are suspect? There's a deliberate obfuscation of data that we've seen from the beginning of the pandemic. But there's a lot of other kind of data sources that appear to indicate, Megyn, that the vaccine is causing more deaths and injuries than it is averting. One of those data points is the nation-by-nation data, and this is in my book, that show that the nations that have the highest vaccination rates also have the highest death rates from COVID and non-COVID deaths. And there are many, many others, and you can do, state-by-state comparisons, and there are a lot of clever people who are looking at this right now. And I have not seen any data that indicate, with one exception, which is a very weak study that is now being cited. I'm not seeing any study or any really even common sense argument based on science or anything else, or any form of empiricism that shows that the vaccine is actually saving lives. I think the vaccine appears to be doing what the clinical trial indicated it would do, which is to increase mortality in the vaccine group over the placebo group. The one study that I'm talking about is a study that is now being widely cited by the New York Times and everybody else, with some glee, it appears, that indicates that Republican states have a higher death rate from COVID than Democratic states. In other words, the red states are doing worse from COVID than the blue states. But it's a fairly kind of sophomoric study that you can't say anything about the vaccines, and it may be true that more Republicans and Republican states died from COVID, but there are a lot of other covariables. You know, those states tend to be poorer states. There are also lots of studies that show that those the regions that are more dependent on fast food, they have higher levels of diabetes, of obesity, which are the primary covariables that predict COVID deaths. I noticed in the study, I think this is true, that they also include Florida in that study. And so you're looking at a population that is disproportionately elderly, and we have no idea. There's no indication that this has anything to do with vaccination status. It's, that's very speculative, but that's literally the only study that I've seen cited with a proposition that the vaccine is actually saving lives. And I can't say whether it is
question for you.
I suspect it is not. I suspect the vaccine is causing more deaths and it is averting. But I cannot give you the numbers, and it's not my fault that I can't give you the numbers.
No, it's not your fault.
Because we have looked at every kind of permutation of data that the government will allow us to see. And it's very, very hard to come up with exact numbers from looking at that. And that is, I have to say, it has to be deliberate. These are the first things.
It's
if you were a public health
at a
official,
minimum, it's a dereliction, and it could be deliberate. Wait, let me just stand by and ask you one thing. I want to get back to your theory that it's deliberate.
That's a better way of putting it.
Because the only thing that jumped out at me on this, because there is a question. I mean, I saw the charts in your book that showed a spike in deaths post mass vaccinations, and not exactly post COVID outbreaks. You know, the spikes came post mass vaccinations, but then I looked at Sweden, and they're heavily vaccinated, but they didn't have the spike in morbidity. And so that to me suggested that maybe it's more lockdown deaths, deaths of despair here that we're seeing, as opposed to necessarily tied to vaccinations. I realize they use a different vaccine over
charts, which are from Johns Hopkins data, or every country in the world. And it's very, very consistent after mass vaccination, irrespective of lockdown status, because the vaccinations came after a year of lockdown or 6 months of lockdown. The lockdowns were already in place in many places, and I know of Australia and Austria and many others, virtually in every place. And yet you're still seeing these, these huge spikes in COVID deaths immediately after vaccination. I'll tell you one other thing. We're getting good data from certain countries that were early adopters of the vaccine, like Israel, like Singapore, Japan, New York State, which has a good database, and other places, the UK, et cetera. And what we're seeing is evidence of a phenomena that was predicted at the outset, called antibody-dependent enhancement. It's also called paradoxical priming. And what it means is that the vaccine directs your immune system to a single strain of a single clade of a single pathogen. And in doing so, it weakens the rest of your immune system and makes you susceptible after a certain amount of time to not only that infection, not only other strains, but that infection as well, and other diseases. And what we're seeing is now that the vaccine appears to have, here's the way that I read the data, and this is a hypothesis, so people should not believe me. And I always say this, People need to read the science on their own, but I'm going to give you the hypothesis that I think is true. And, that if you can show me data that is not true, then I will correct it. So this is just a hypothesis, but a lot of people believe this, and there's a lot of data to support it. That the vaccine is ineffective for the first 6 weeks after the first shot. I'm assuming a two-shot, a two-dose vaccine like Pfizer or Moderna. And that during that period, the COVID infection rate goes up and the death rate goes up. And the data, the official data, do not count you as vaccinated until 2 weeks after the second shot. So the deaths that happen during that first 6 weeks are attributed to unvaccinated people, to the unvaccinated group, which is not, it's a trick. It's a statistical trick. Then the vaccine appears to provide immunity, and good immunity during the first month or 2 months, and then a precipitous decline, a waning that happens very, very quickly and very precipitously, so that by the 7th month, it has lapsed into negative efficacy. And what that means is that after 7 months, if you had that vaccine, you are more likely to get COVID than somebody who has never been vaccinated. And this data is holding up across every country in the world that we have good data sets. And this is exactly the problem that so many scientists warned about at the beginning, including Anthony Fauci.
There's so much to love about fall, right? From the cooler temperatures to the changing leaves, everything pumpkin spiced, Halloween, everything. Love the whole season. What better way to soak up the best of the season than with a Michael Phelps swim spa by Master Spas? A Michael Phelps swim spa combines the benefits of a pool with the therapy of a hot tub. It comes in a variety of sizes to complement almost any yard, even if it's a small one. Master Spas worked with Michael Phelps to develop an at-home training and fitness solution that you can use year-round in any season, even in the winter. As your fall calendar fills up, a Michael Phelps swim spa is the perfect place to spend time together as a family. Michael Phelps swim spas are 100% made in the USA by Master Spas, the world's largest swim spa manufacturer. It is energy efficient. You can use it all year long. Go to masterspas.com, put in the promo code MK to save $1,000 on a Michael Phelps swim spa or $500 on a Master Spas hot tub. That's masterspas.com, promo code MK. Hey, thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.